Can exercise influence cancer outcomes? This is Dr. Patrick Hu from Moffitt Cancer Center. We're very fortunate to have Dr. Nate Parker here, who is a Moffitt Cancer Center team member and faculty member in health outcomes and behavior, and his expertise is in cancer and exercise. So, Dr. Parker, thanks so much for being here.
It's my pleasure. Thanks very much for having me.
Tell us a little bit about your research, what your area of focus is, and how you got interested in this area.
My research has narrowed in on a field called exercise oncology, where our goal is to use the power of exercise to help improve outcomes during cancer treatment and then into cancer survivorship. I'm particularly interested personally and professionally in resistance or strength training, which is exercise programming that's designed to improve strength and build muscle or slow down muscle loss. We'd know it by weightlifting, for example, or using resistance tubes or our body weight to put a load on our muscles that helps them get stronger.
Great. So what role does strength training exercises play in cancer treatment and outcome?
So exercise in general can play huge roles in improving cancer treatment and survivorship outcomes. And the benefits of exercise really apply to people following cancer diagnosis too. At this point, we have strong evidence supporting the efficacy of specific doses of exercise, both aerobic and strength training, to improve fatigue, quality of life, physical functioning, and anxiety and depression among patients diagnosed. And that's across a number of different cancers. Then we have moderate evidence, at least, linking post-diagnosis exercise and physical activity to lower risk of cancer-related death among people with some of the more prevalent cancers. And there are so many more potential benefits from exercise after diagnosis with cancer, even extending to slowing tumor growth and improving treatment tolerance. So as a field, we're working to collect data to help evaluate those.
So a lot of your research is focused on patients who already have a diagnosis of cancer. What about the prevention of cancer? What kinds of exercises are best for this?
Really just maintaining a healthy weight is a critical piece of cancer prevention. So a mix of aerobic and strength training can really be important in doing that. Aerobic exercise, of course, is more tailored to burning calories and helping to balance out energy intake, whereas strength training helps to build muscle, which helps us in turn burn more calories and be stronger and more physically active and maintain our stamina, especially as we get older. So both are really critical. And the key is finding a program and a balance of activity and types of activities that somebody can stick to. That's kind of the critical piece of this. Find something that you enjoy and find ways to stick to it.
Are there any specific cancer types that you're focused on and why?
So a lot of my work to date has focused on individuals with pancreatic cancer. And that was both the way that my career and training developed and the group that I happened to be working with in my previous position, but also a really important diagnosis and context for exercise because there tends to be a great deal of age-related skeletal muscle loss or sarcopenia in that group. And that muscle loss can accelerate with cancer, pancreatic cancer diagnosis, and the treatments that people go through. And that in turn can lead to worse outcomes during treatment and into survivorship. So I've had no shortage of productive meetings speaking with clinicians here to brainstorm and develop ideas to get exercise research going with patients in their clinics as well.
So how are you translating the research to the clinic for our patients here at Moffitt?
So short term, basically what I'll be doing is providing patients opportunities to participate in research-based exercise programs that can help them stay strong through their treatments. Long term, though, I hope to be a piece, and I plan to be a piece of a much bigger puzzle, and that's sort of a collaborative effort to work with clinical teams and colleagues in areas like implementation science to help integrate exercise programming into cancer treatment and survivorship plans for patients and survivors at Moffitt. So we know it's important to get folks exercising and active.
Thanks so much. We're so fortunate to have Dr. Nate Parker with us today, expert in exercise and cancer outcomes. Thanks, Dr. Parker.
Thank you, Dr. Hu.